Hi, my name is Marion Orr. I'm a clinical counselor at NeurAlive. I work with youth, adults, couples, and families. I think when people hear the word trauma, they think a big incident or something that's been really impactful. People think of war, they think of natural disasters. But we don't necessarily think about that it's less about the event and more about how it's impacted somebody. So it could be a series of events. It could be something that's happened throughout your childhood or something that's happened throughout your adult life that's impacted you in ways that you didn't expect. And often that can manifest as various behavioral challenges or sadness, difficulty sleeping. People often talk about feeling triggered, right? That they don't know why they reacted the way they did, but they did. And so that can just tell you that you've been impacted by something that was traumatic, whether or not you would define it as trauma. Of course, it can include things like those big events, but it can also be very subtle. A good example of that is people talk about child abuse, but they don't talk about child neglect. People don't think about the impacts of a lack of connection and how severe that is. So when I think about trauma, I think about not just how it impacted you as an individual, but how did it impact your relationships? How did it impact your sense of connection and belonging in the world, your sense of purpose? So I think trauma can really be all-encompassing if we're not aware of, or if we're limiting our definition. We're not aware of the scope of it, how it actually is something that almost all of us have experienced in some way, shape, or form. Then we can really hit the ground running with recovery. One of the things that I think can be unexpected about trauma or trauma impacts is the amount of grief that people experience. So if somebody's lived through a life with a lot of loss, when something bad happens to them or to somebody that they care about, that grief and loss is right back up again, and people can get surprised by that. So I think that's another element of trauma that can be left out, and yet is another reason why people come to counseling. They're saying, I'm feeling really sad, or I'm thinking about all of these things that have happened from my past. And it's often very closely related to something that's happening in their present day life that's difficult for them to manage. I heard a really good term yesterday. We all carry around a grief case, and that trauma work and therapy, addictions work, these are the opportunities to open up that grief case, figure out what we want to carry with us and how. It's not always about ignoring it. It's let's look through this, let's figure this out. But I like that because it has a visceral feeling, right? Like grief is such a body-based experience that I think sometimes tuning into that can be really helpful as well. For me, therapy is also not just, let's talk about it. It's also very, let's figure out what you're feeling about it, how you're experiencing those emotions in the body, and how do you feel about that? I often say they're called feelings for a reason, because we feel them. When we're crying, that's a biological response to an emotional experience, and that is your body expressing. So when we think about what's happening, how emotions are stored in the body, or how our history is stored in the body, that's a good example of how our physiology, our bodies will respond to the world around us. And we want to factor that in terms of how we are navigating change. Because if I feel the same, even if I think differently about something, I'm not actually fully integrated. One of the problems, coming back to trauma, is that we disconnect. We can disconnect from our sense of self. We can disconnect from our body. Some people talk about dissociation, right? That you don't feel connected. I feel numb. I'm not sure what I feel. And sometimes people don't have to have trauma to not know how they feel, right? But you'll hear yoga instructors talk about how somebody's started crying in the middle of class while they were holding a pose, and they didn't know why. Emotions can be experienced in the body, stored in the body. That's one piece that often also gets neglected, is that people situate the trauma or the anxiety or the diagnosis within their own body, within themselves, and they say, I'm the problem. We hear this a lot with teenagers, the low self-worth stuff, the perfectionism piece, people feeling like they're not good enough. We're situating so much of it in ourselves and putting all this pressure on ourselves when none of us operates in a cave or in a vacuum. We're all in relationship all the time. We've learned who we are through relationship. We're developing a sense of self ongoing through relationship. And when we feel the need to withdraw, when we feel that shame, when we feel like we're not good enough or unlovable, even if we're not using those words, if we're feeling that way, we tend to withdraw. And that's the opposite of what we need. So when people want to access counseling for trauma, there is also that discussion around, how are your relationships? How's your context? How's your environment? Where do you feel safest? Who do you feel safest with? Because the work happens outside of the therapy room. We might meet 1 hour a week, but the real work is in relationship with your environment, with your faith if you have one, with your loved ones, with your parents, with your kids. All of that is really where we do our best healing and have the most traction. I think it starts with understanding what your expectations for change are, and then us being able to have a conversation around it and figuring out what's feasible, what's realistic, what's possible, and then collaboratively identifying a plan for change. Sometimes people want somebody else to change. It's not realistic. We want to be able to look at how we are impacting that web of activity, and web meaning the network we talked about. This is where my approach is a little bit integrative, because when I think about change processes, I think about the work from acceptance and commitment therapy where they're looking at values. What are your values, really? Because sometimes we want to change a behavior, but if we can really get down to the why do we want to change that behavior, we're going to have a little more traction than if it's just, I don't like it. And that can be hard to identify, right? We're very easily drawn into the I don't like it because that's where we feel the most pain, discomfort, shame, all of those things that we want to get rid of, all of those bad feelings. But this comes back to the mindfulness and insight piece, is that we want to be able to notice those things. We want to be able to experience those things enough to say, okay, this feels bad. This is part of what it means to be human. Bring in some compassion for ourselves or for the ones around us, that, yeah, we all experience these emotions, these feelings, and they're uncomfortable. Okay, and come back to values. What's most important to me? So we have to have the mindfulness to notice what's happening. And that's a skill. That's a skill we can develop, right? And notice when we're trying to avoid or get rid of something. If we're on the path to get rid of it, it's going to be a little bit longer than what am I moving towards instead? What do I want to anticipate? What are my values? What am I moving towards? What's most important to me in my life? But then we want to bring in the compassion piece, because it's really hard to change if we're shaming ourselves or shaming those around us to change. So looking at either how do we create an environment within our relationships where shame is kicked to the curb. Let's work on compassion and curiosity with each other to support change processes so that we can do that in the shared space. Or if it's within an individual, how do we want to create that compassion within to be kind to ourselves so that we can acknowledge when we're making mistakes and work towards something else. The more I learn about therapy and therapy methods, there seems to be these core themes, and mindfulness being one of them. Right? If we can't notice what's happening, it's hard to have insight around how to change. So it's such an important piece to being able to slow down in relational conflicts. Can we just slow down, right? In a day-to-day moment, can we just slow down enough to breathe some oxygen into those other parts of our brain that we can think a little bit differently and then respond differently? It also connects to gratitude. If I can notice these other things, then I can also notice what's good. It's another important part too about therapy, right? Is that it's not just to come and talk about problems. It's also to explore what's good, what's working, because we can lose sight of those things. That's one of the challenges about therapy, is it's an unnatural hierarchy, right? So people feel like they're going to an expert or a professional for help. But I like to remind people that they are the experts. So if they have questions, there's no wrong question to ask. And in fact, if there's anything that's nagging them in the back of their head that they need to feel comfortable or safe, that's important. Because without that safety piece, we're not going to get very far. And the therapist is there to help, right? So I'm there to help. And so if people are unsure about something, it's really important that they ask or inquire, that they have the right to do that in order for us to see if we're a good fit as well. And that could be anything. Some people want to know about scheduling. Some people want to know, is it okay to talk about this kind of thing? Some people want to know, what are the confidentiality rules? If I say something, are you going to tell somebody? Those are all really valid questions, them and beyond. There's no wrong question. I think for anyone who's uncertain, it's logical. It makes sense. Starting therapy the first time or starting with a new therapist can really feel like a lot of work. It can be overwhelming. It can be scary. And at the same time, people are feeling called to it, there's something in that, right? There's that inner compass, if you will, right? That part of them that's guiding them towards this and saying, I kind of am thinking about it. I do encourage people to do that 20-minute free consultation just to feel it out, right? If they end up with that conversation and say, that didn't quite feel right, then they'll know. But if they feel called to it or curious about it, you don't have to know for certain. I think just that curiosity is enough to just take a risk, give it a try. I really love my job. And I think that my clients in the past have said that makes all the difference. They don't want to work with somebody who is burnt out or doesn't really want to be there. But that doesn't feel comfortable or safe. It doesn't feel like a good working environment. But one of the things I love most is how people can show up for themselves, how we can work together. And it's just the best, seeing people grow and get to where they want to get to. Top notch.